My disease process is Sepsis Neonatorum. Neonatal sepsis is a blood infection that occurs in infants younger than 90 days old. You can have early or late onset. Early onset sepsis is seen in the first week of life. Late onset sepsis occurs after 1 week through 3 months of life. Sepsis occurs in less than 1% of newborns, but accounts for up to 30% of deaths in the first week of life. This is mainly caused by ascending infection in the mother with chorioamnionitis, perinatally via direct contact in the birth canal, and hematogenous spread. The etiology is neonatal sepsis can be caused by bacteria such as E. coli, Listeria, and some strains of Streptococcus. GBS has been a major cause of neonatal sepsis. However, this problem has become less common because women are regularly getting screened during their pregnancies. Some signs and symptoms you might see are body temperature changes, breathing problems, low blood sugar, reduced movements, diarrhea, decreased bowel movements, reduced sucking, seizures, slow or fast heart rate, a swollen belly area, vomiting, and yellow and whites of the eyes, which is also known as jaundice. The treatment options: infants that are younger than 4 weeks old who have fever or other signs of infection are started on intravenous antibiotics immediately. The infant will get antibiotics for up to 3 weeks if there's still bacteria found in the blood or in the spinal fluid. However, treatment will be shorter if there's no bacteria found at all. The antiviral medication that they might use is acyclovir, and it'll be used for infections that may be caused by HSV 1 or 2. Older babies who have normal lab results may only have a fever might not be given the antibiotics or the antiviral medication. Instead, the child may be able to leave the hospital and just come back every once in a while for checkups. Babies who need treatment and have already gone home after birth will most likely just be admitted to the hospital for monitoring. Some nursing interventions that you might do is the nurse will monitor the newborn's temperature every 30 minutes. The nurse will perform APGAR scoring until the score is at an overall 7. The nurse will keep nursing care organized and prompt during the infant stay, because if you aren't staying on top of your tasks, like checking for the APGAR or checking for the temperature, and something changes, then you could have catastrophic results, because any small change could mean something very bad. Patient goals is the patient will get an APGAR score of 7 or above before discharge. The patient will maintain a stable temperature through the first month of life where the disease is at its strongest. The patient will be absent of infection and all signs and symptoms by the time of discharge. Early onset neonatal sepsis most often appears within 24 to 48 hours of birth. The baby gets the infection from the mother before or during the delivery. There are a few things that can increase an infant's risk of early onset bacterial sepsis: GBS colonization during pregnancy, if you have preterm labor, or if your water breaks for longer than 18 hours before you give birth to the baby. And chorioamnionitis could all increase the risk of having early onset neonatal sepsis. Babies with late onset neonatal sepsis are infected after delivery. Having a catheter in a blood vessel for a long time or staying in the hospital for an extended period of time could increase the risk of a baby getting sepsis after they've been delivered. In the end, a mild case of sepsis usually clears up with treatment. The baby will not suffer any longer-term problems with development and growth, but the child will be at a higher risk for developing fresh infections, and their immune system won't be strong and stabilized for a little while. And then once it does, they should be perfectly fine of everything. Yeah.